Anxiety.
It's an anxiety skill. Now, I just want to add some information on that.
Kok hilang ini, Mas? Ini speakernya hilang.
Mungkin di sana yang putus, Mas. Soalnya di sini pada normal aja.
Ntar saya cek ya.
Coba cek. Mungkin jaringan atau mahasiswanya tuh masih ada lah. Mahasiswa masih ada. Mahasiswa di sana. Tahu mahasiswa di sana masih ada nggak? Masih ada. Mahasiswa di sana juga masih ada, Mas?
Sebentar.
Sorry. I lost my connection. Sorry about that. Okay, I just come in again. You want me to? Maybe I can answer that questions a little bit later so that we can have the next presenter going on now. Is that all right with the host?
Yes.
I will save this sharing later. So we actually get on the conference on time for the next presenter. So not to be disrespectful for the next presenter, okay?
Thank you.
Iya, beliaunya bilang ini masih ada waktu enggak kalau misalnya next speakernya takutnya nunggu lama.
Oh, you want me to answer now? I have to ask the host. What did you like me to do?
Masih ada waktu enggak? Berarti nggak bisa jawab deh. Okay, my pardon, Professor, we have running up of the time because we are going to the next speaker.
Maybe my professor, my suggestion, maybe you can write down the answer.
Give us suggestion.
Yeah, I will help you to share to the students about your answer, because another discussion session will be belong to the next speaker, right? Tadi saya menyampaikan untuk ditulis saja, Mas, jawabannya. Jadi tidak apa-apa, dilanjut saja ke speaker yang selanjutnya.
Okay, that's all our first presentation and discussion. Now we are going to from the next speaker. Before I present you for the next speaker, I would like to read his profile first. You can share screen. Okay, his name is Mr. Agianto, Faculty of Medicine, University Lambung Mangkurat, and his lecture Department of Medical Surgery Nursing, Head Cooperation and Public Relations Unit, Faculty of Medicine, Lambung Mangkurat University, Director of School Nursing, Lambung Mangkurat University, Peer Review of Nursing and Health Journals. And the last education is got the Doctor Nursing Philosophy from the Faculty of Nursing, Kokkain University, Kokkain in Thailand. And from the research publication, he has 33 articles published in the national and also the international publication, 9 copyright material holders, and 4 nursing books. And he also got 20 honors and awards have been received, national and international awards, and 80 activities including as moderators, speakers, and presenters in scientific meetings, national and international awards. Now, please have me the present to you. Please welcome Mr. Agianto, Escape NS MNS PhD. Will present the material about nursing care plan of a stroke case in Indonesia. Mr. Agianto, time is yours.
Thank you very much, MC, for introducing me first. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Greeting from Indonesia for you who stay in Taiwan. I'm Agianto, and this morning I'd like to share my experience about nursing care plan for stroke. I'd like to share my PowerPoint, try to share screen. And this is about my experience based on my study report, as well as the Indonesian situation, and also in South Kalimantan province situations. Well, can you see my PowerPoint here? Well, this is just the previous theory about stroke, as we know that before that. Stroke consists of two types of stroke, ischemic and hemorrhagic stroke. And we have to know as a nurse that for stroke in ischemic usually is caused by emboli or thrombolytic, as we can see here, that the etiology of the stroke ischemic is there are many factors. And also for the hemorrhagic, it's depend on the location of the rupture of the vessels. Like maybe it could be in subarachnoid space, intracerebral, and also interventricular of the brain. And this is the mind map of my study in the community as well as in the hospital. If we talk about the nursing care plan, it's based on where is the area that we face to the patient and the stroke patient family. If we meet them in the community, so we have to take care of them in the community setting for nursing care plan in the community. But if we face and meet them in the hospital, of course, we can take care of them in the hospital. The nursing care plan between community and the hospital is totally different. And in Indonesia now, in this situation, in the pandemic situations, last year, we have the small number of the stroke patient in the hospital because the physician, the neurology specialist, they refer the patient to take care themselves and the family in their home, in their own home. But if the patient have the severe prognosis, the severe situation or condition, so they can admit to the hospital for hospitalization. So the number of stroke patients in the hospital during the pandemic era is very slow. But now, in current situation this year, 2022, the stroke patient in the hospital increasing for the hospitalization. And I'd like to share my experience during we take care of the patient in the hospital. So during admit to the hospital from the emergency room to the stroke care unit or neurological unit, or maybe internist ward, it's depend on the hospital. They have the neurological ward or not. If they don't have the neurological ward or stroke unit, usually the patient will take care in the internist ward. And after that, if the patient have the stability condition, they can prepare for their home or discharge planning. But if the patient in acute phase, usually the health workers transfer the patient to the intensive care unit, maybe ICU or something like that. But if the hospital has stroke unit, usually they can transfer to stroke care unit directly. So it's depend on the facility and the condition of the hospitals. And this is the intervention that we can do as a nurse. Don't see the pre-hospital or hospital emergency, because this is another intervention, another nursing care plans. But we can see here when the patient admit to the stroke unit or neurological unit or in the intensive care unit. So we have to identify, we have to assess the general assessment of the patient, including neurological status, level of consciousness, and then is there the increasing of intracranial pressure or not, such as nausea, vomit, headache, and then hypertension, or the increasing of diastolic pressure, and also vertigo maybe, because some of patient also have the vertigo, seizure if the patient in the coma state. And also we can measure the oximetry, oxygen saturation, measure the temperature, and then identify the patient had injury or not, and then assess the thorax or lung, and also cardiovascular, because for stroke ischemic, usually it's related to the emboli and the heart disease. And also we can assess the patients, the level of severity of stroke using NIHSS, National Institute of Health Stroke Scale. And also we can assess the neurological status and assess the meningeal reflex, also the sensory and motoric system. If the patient can walk, so we can assess the gait of the patient, coordination test, and cognitive function. It's depend on the severity of stroke. If the patient come to the hospital in the coma state, so we cannot assess in for coordination, cognitive, sensory, motoric, because the patient in coma state. So we focus on the hemodynamic status. And how to take care of the patients, this is very necessary for nurses to know what we can do for the patient when they come to the hospital. Usually in the emergency unit, the medical doctor, they inserted the IV lines and give the mannitol for the increasing of ICP. And for the nurse, what can we do if the doctor do this? So we can measure the blood pressure, and then give the position for head up, range from 20 to 30 degrees. And then don't make the flexion of the neck, because it can flexion of the jugular veins. It can impact to the circulation to the brain. And of course, the oxygen in the brain is very low. And also we can give another treatment from the doctor, such as giving the drugs, and then oxygen therapy. If the saturation more than 75%, it depends on the situation of patient. We can give the simple mask, or maybe binasal canal. And also if the situation, if the patient in the coma state, we can collaborate to doctor. The doctor will insert it the ETT. And also we can check the blood to measure, to know the oxygen pressure, saturation, carbon dioxide, and then best access, something like that. And we have to monitor the intracranial pressure, because mostly in South Kalimantan, I think not only in South Kalimantan, but also in another area, that ICP is happen for the stroke cases. So we have to know this and be careful to take care of the patient. So early physical examination is very important to do by the nurses, and also measure the blood pressure, doing the heart examinations, neurology examination for GCS for the level of conscious state. and then the paralysis or the mobility or the neuromuscular of the patients. And this is the activity that we did for our patient in stroke center. In South Kalimantan, for stroke center is in Ulin Regional Hospital as the primary hospital. As the tertiary hospital, and also the education hospital. So they have the stroke center or stroke unit already. And for another hospital, they just have neurological ward and internist ward. So some stroke patient also take care in the same area with another cases in the hospital. So I will talk about stroke center in the tertiary hospital in our province. So the patient who take care, who admitted to the stroke center, so we have to concern about the fluid of the patients. Usually we give the isotonic fluid, isotonic or NSS 0.9%. We didn't give hypertonic or hypotonic fluids because it can make the udem cerebri or inflammation of the brain. So we have to we usually give these fluids. And also we try to prevent the increasing of ICP. How can we prevent as a nurse? We can manage the bed of patients. We can head up the position of patient. The bed using has the how to say, like it has like degrees, how many degrees for this position, something like that, by the manual or by the control, electric control. And we can prevent the increasing of ICV for mobilizations. And be careful for mobilization. We cannot mobilize the patient if the type of stroke hemorrhagic. We have to take care of the patient for immobilize during 0 to 7 days. And after that, we take care of the patient. We can change the positions gradually. And if the patient is in ischemic stroke type, we can mobilization of the patient in the 3rd day or 4th days, so we can follow the guideline from the neurologist association in Indonesia. And also how to take care of the patient, help to the bathing, toileting, and then grooming, dressing, and other for daily care. So we have to involve the family who stay together, who accompany the patient in the hospital as well. So family involving is very important to take care of patient in the hospital and also in the community. So we always involve them, not only health workers who take care of the patient during the hospital, but also family. How about the stroke center? Yes, in the stroke center, at least one family have to accompany beside the patient during hospitalized. And before they're going back to home, we teach them how to take care of the patients. And also we concern about nutrition interval within 48 hours. If the patient has positive for swallow reflex, we inserted the I mean, if the positive swallow reflex, we can help the patient's nutrition by oral. But if the swallow reflex is negative, patient cannot give something to the mouth, means that fasting, and we can insert the NGT for the nutrition. And after that, ventilation and also complication treatment. We try to change the position every 2 hours from right side to the supine and the left side, and then also massage the back massage, and then the shoulder, and then the pelvic area, and another bone that is very high risk for the pressure ulcers. and also give the medical treatment, such as we monitor the blood glucose, because mostly the patient who admit in the hospital is with the diabetes mellitus, with ischemic stroke, and we help monitor this, and also give the minor and major tranquilizer or anxiety drugs. This is as doctor orders, and give the analgesic, because headache is very common for the stroke patient with high ICV, and antiemetic, and also for the bleeding gastric. And after, for the patient with ischemic stroke, we can do rehabilitation at the 4 days until 7 days, and we can call and involve and collaborate with the physiotherapist or the medical doctor who specialize in physiotherapies, medical rehabilitations, and also we can prepare the patient to get rehabilitation when they going back to their home. Even the situation is not good, like in the pandemic situation, they can bring the patient to the near rehabilitation center, not only in the hospital, but also in the clinic practice of the medical doctor, or maybe they can call the physiotherapist or the health worker who can help the rehabilitation to their home. It's depend on the situation of the family and the patients. And also we educate the patient family when they admit in the hospital. For the family, of course, we educate them how to take care of the patient, how to help the patient for bathing, how to give the meal, drinking, and also how to help the patient for the change positions, because as a nurse, we cannot work alone in the hospital, but usually we always involve them and encourage and also motivate the family to do this, because this is these activities, this role is not easy. It's very difficult. The family not only help the patient in the hospital only, but also help to the patient in their home, in the community for long times. And we also doing the discharge planning for the patient and family, but especially for the family. What will we do? Prepare the family knowledge, prepare the environment when they come to their home, and others. I will explain more detail for the discharge planning. What can we do? What can we teach to the family? And this is the nursing diagnosis that we usually make for our patient. And for the assessment, I do agree that for nursing process, we started from assessment and continue to formulate the nursing diagnosis, and then we make the nursing outcomes, well as intervention, implemented the whole planning intervention, and we can evaluate it. And I'd like to just give new information for our participant, for the student here. This is the most question from our student who practice in the hospital, and also the most question from the nurses who work in the stroke unit in the hospitals. If the patient admit to the hospital in the stroke center with high ICV, and what is the nursing diagnosis that we can formulate for these cases? Because in NANDA 2021, the diagnosis for the high increasing of ICV, such as decrease of intracranial capacity, is retired from the NANDA diagnosis. And what another diagnosis if the decrease of intracranial capacity is already retired from the NANDA? So we can move and we can read in the NANDA book that this diagnosis retired because the evidence base is not enough, and then the intervention to treat this problem, this diagnosis is not only for independent intervention by nurses, but need dependent or collaboration intervention with another profession. It means that we can see another references from Linda Jola Carpenito. So they have the PC, intracranial, increasing intracranial pressure. So we can collaborate with the doctor giving the mannitol IV lines and then give another drug or drug administration, something like that. And this is some of diagnoses that we usually formulate for stroke patient in the hospital, but not only in the hospital, but also when we teach the student who practice in the hospital. This is the nursing diagnosis that you can formulate for the patient based on the data assessments. And of course, after that, we can make the nursing outcomes. It's depend on what the nursing diagnosis that you have. If you have the acute pain, of course, the outcome is pain control with some indicators. We can see the NOC book and also the pain levels. And after that, we can make the nursing intervention for that diagnosis, such as pain management, analgesic administration, and another intervention that appropriate to our patient in the hospitals. The topic before me is talking, the question is about NANDA or not for doing the nursing care plans in Indonesia now. In current for now, we use standard from Indonesian Nursing Association. We call SDKI in bahasa, or SDKI, Standard Diagnosis Keperawatan Indonesia, or Indonesian Nursing Diagnosis Standard. But this book, this standard, was developed from NANDA International as well. It's almost more than 90% of the nursing diagnosis in the SDKIs is come from NANDA International book. So if nursing students or nurses who work in the hospital, in the community, don't worry about which one do you want to use, SDKI or NANDA, because the content of SDKI is quite similar with NANDA books. But if you only use SDKI, means that maybe the content of nursing diagnosis is not updated yet, because for NANDA, they always update every 3 years. And this is some of the intervention that we give to our patient when they take care of the patient in the hospitals. So we always monitor the ICP, and then concern about the cerebral perfusion enhancements, because the patient has the problem for the perfusion, brain perfusions, and doing exercise therapy. Sometimes we doing by ourselves as the nurses, and sometimes we collaborate with the medical doctor who specialize in physiotherapies, and also this exercise therapy doing by physiotherapists in the hospitals. And bed rest care we have for tapping bed sponge, and then shampooing, and then dressings, positionings, and then taking care of the IV lines and invasive insertions like catheter, urinary catheter, and NGT. So the total care is needed by the patient in the stroke unit. So for the documentation for the nursing process, we still use documentation sheet using the checklist, because the hospital not provide the computerized yet. But in another hospital, like a private hospitals, they already use the computerized to document the nursing process that nurses did during they take care of the patient in the hospitals. But for the public hospital, they still use the paper base to document the nursing process using the checklist. It's easy for them to give the tick for every nursing assessment data and then nursing diagnose that already exist to the patient, and then the outcome as well as the nursing intervention. And for the documentation like the progress report, SOAP, or another type of the documentation, they're still also using the manual documentations. This is quite different when we see the experience, the system in Taiwan. They already use the computerized documentations, but in another hospital, especially in Java Islands, mostly they already use the computerized. In Banjarmasin, only 2 or 3 hospitals that already use the computerized, and another hospital they still use the manual documentation. This is very tired or not? Yes, of course, it's very tired because the patient have to take care, total care for the patient in the stroke center, as well as have to document every intervention that already give to the patients. And this is the discharge planning that we can give to the family and to patients before they're going home. So we teach them, especially for family, because it's difficult to teach the patient because the situation, the condition of patient difficult to teach something because they still have to take rest and other things. So usually we teach, educate the patient for this topic like ADL, how to help the patient for personal hygiene, eating, drinking, dressing, toileting, and others, and provide and help the NGT nutrition. We teach the family how to give the enteral feeding to the patient when they going back to home. And sometimes in the hospital, they try to give by themselves for NGT, for enteral feeding, and also help them to take care the urinary catheter, to clean the catheter, and also cut the nail for a penny or pedicure, and also for drug administration. We teach only the indication, contraindications, and how to come to doctor for follow-up. And for IVFD, we just inform about what kind of fluid that appropriate or not, but the patient just to know this information, but not have to do by themselves for drug administration and IVFD. And also massage and traditional treatment is very also happening in Indonesia, not only in South Kalimantan. Usually, not usually, but most of them, they always involve the measures to help the patient to massage. But we educate that when that patient can get massage. In the first attack, in the first acute phase stroke, we inform them that patient cannot get massage because the condition is unstable. But when the patient is in stable condition, so we can involve the massage. The massage, it can help the strengthen the muscles of the extremity, but it cannot help the repair of the blood rupture in the brain. And also how inform them, teach them about the pressure ulcer prevention, and then if there is a wound because of pressure ulcer, we help them to clean it up. But they can call the nurse who practice in the community for home care to help them for doing the wound care, and also help them the fall prevention, and then try to manipulate the environment to help the patient when they stay in their home, and also rehabilitation, give information where, when, and what they have to do for rehabilitation in their home. Not only in the home, but they can come to the hospital and then the private clinic by doctors, and also in the community that already exists in the community, and help them for speech therapy as well. But sometimes we involve the physiotherapists or speech therapists to help this, and also involve the occupational therapists to have the occupational therapy, and then check up the blood pressure, laboratory, and also about the social activity and spiritual activity. This is very important in South Kalimantan, because when they stay in the hospital, they want to do the spiritual therapy. They want to neighbors, kinship, friends come to the hospitals to give the patient support. But now in the situations, the hospital give the regulation policy that there is no visitors to come to the hospital. So it impacts to the patient and has high psychology problem, because they got low motivations. There is no friend to give motivation and something like that. And this is the early handling of stroke in the community by a family. This is another type of the nursing care plan. This is what the family do in the community, in their home, if someone got stroke attack. This is based on the qualitative study research by me. And one of the early handling or intervention that family can do is medical handling. Call the hospital or bring to the hospital, transfer to the hospital, or maybe can bring to the doctor clinic. It depends on the accessibility of the health facilities, which one is very short, very near to the patient and family. And calling health worker at home if they don't want to bring the patient to the hospitals. And some of them, they use traditional handling using massage. There are many kind of traditional healing that they use, not only minyak kayu putih, but also another herbals, and only traditional healing that they implement to the patients. But some of them, they combine between medical handling and traditional handling, bring to the hospital, and invite masseurs and traditional healers to the hospital to help the patients. So during the hospitals, they also, I mean, the family also invite the traditional healers to help them to give the massage to the patients. And sometimes the doctor, you cannot do this because the situation, the stability of the patient is not good yet. You can do this after the patient in the stable conditions. So we have to very careful give the education to our patient and family, because this is very, very sensitive, because this is about their beliefs and their culture. So we have to be careful to inform this in the hospital when we take care of the patient about this. And this is another kind of the early handling that we can that the family can do. So we teach them, if the patient come back or discharge from the hospital and come back to their home, the family have to identify, have to assess signs and symptoms of the stroke attack, because the stroke attack mostly come to the hospital for the second, the third. Recurrent stroke is very, very more frequent for patients that admit to our hospitals. And also the family can call people, maybe health worker or maybe non-health worker, that can help them to take care, to bring the patient to the near health workers, health facilities, and then deliver the patient to the healthcare service as soon as possible. Because in South Kalimantan, I'd like to inform you this. We can see in South Kalimantan, there are many rivers, small rivers, big rivers, and this is also the transportation that family can use when they can transfer the patient from their home, from the area that stroke attack to the healthcare services. So they can use boat, and then they can use canoe, and it's depend on the situation, not only by car, by ambulance, but also by boat, but on the river. And the geographic of South Kalimantan is also not only river, but also we have like a small mountain, like hills, but bigger than hills. And accessibility from home to the healthcare facilities is also quite difficult, because the road is still in the lanes, and then rock and something like that. So it's difficult for them to bring the patient as soon as possible. So this is can impact to the patient condition as well. South Kalimantan is something like this, and we have to think how to bring the patient as soon as possible, and give the appropriate nursing care according, of course, the neurologist guidelines, and also try to see an appropriate nursing care to their belief and culture. All right. Thank you very much. That's my presentation about nursing care plan in Indonesia, especially in South Kalimantan. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
About the stroke cases in Indonesia. So the next is, let me give opportunity to the audience, participants, students, and also the lecturer. If you have any question about the stroke cases in Indonesia, please ask. Okay, does a participant has question? Student from Nursing Academy, KESDAM. University of Nursing, Health and Science. Do you have a question? Mr. Eric? Okay.
Thank you for Dr. Angiato. Is that how to spell? Yeah. I enjoy your presentation, and I think I really enjoy the final pictures you have, with all this beautiful colors that to show how you actually care for the patient with stroke. You also mentioned about the cultural needs of your family, especially when the patient is in ICU but suffering from stroke. And I agree with the stroke process. It's actually a long process, not just acute stage. With the chronic stage or like rehabilitation stage, it's a long process. And you have mentioned about different assessments and also evaluations, intervention you can give it in the ICU state situation, in the hospital situation. You even mentioned about the massage, which is I'm very interested in it, because usually massage is evidence-based information that massage is actually quite helpful for patients' RM and also for their mobility. You have mentioned about the importance of ADL for all the patients suffering from stroke. My questions about your interventions. Do you have an evidence-based protocol that help you to initiate nursing interventions, not just about medicines or medical intervention, but nursing intervention that is evidence-based? because you have listed a lot of intervention and assessment. And I'm quite interested how your evidence base is being progressed and in your unit. And also you mentioned about my second question is that you mentioned about the culture needs, I mean the family needs, because at the moment in COVID-19 in Taiwan, at the same time, we restrict all the family visits. So that means that the family in Indonesia must have the urgent need to see their family in the intensive care unit, and also have this spiritual culture needs, which I think is actually stronger than Taiwan, to pray for your family in intensive care unit. All that actually means that they need to see their frail family in ICU, but at the same time they can't do it. That must be a lot of stress for the patient and for the family. You haven't actually mentioned, my third question is that you haven't mentioned about depression. We already have a lot of evidence for patients suffering from stroke has high level of depressive symptoms, and that is actually been ignored at the moment in our literature and in our practice as well. Thank you very much. I'm sorry, I have a lot of questions for you, but I enjoy your presentation. Thank you.
All right, thank you very much, Professor Wang, for your nice questions. So firstly, I'd like to answer the first question about evidence base that already exists or developed by me or by my friends in the hospital that related the culture or the nursing intervention in the hospitals. So we already conducted the research qualitative study design in the hospital and community regarding the culture belief that related the stroke management in the community and also in the hospitals. So the health workers, doctors, nurses, family, neighbor, and other people around the stroke patient, they always mention that they need massage in the healing process of the stroke, as we know that the process of stroke healing process is very long time, not only 1 week, 2 weeks, no, but long time, maybe year, 2 year, or more than something like that. So we try to make the guideline in the hospital to involve the cultural beliefs such as massage and acupressures and also herbals that we already have on our hand exist, that some articles already exist and used in the hospital for the cultural complementary medicines, alternative CEAM, something like that. And we try to make the guidelines to and propose to the hospitals, but the hospital just accepted the massage only, but for in the stabilization condition of the patient, we can use the massage to help the patient for the strengthen the muscles, the activity, the mobilizations, but we can use it after the patients in the stable situations. And how about the herbal? Another intervention. The doctor still reviews it. They don't want to accept our proposal, our guidelines. But in Thailand, in Malaysia, I already saw them that the evidence that already exists and they involve in the medical treatments. And then, okay, now we can accept the measures only, but another intervention we can keep it. Maybe in the next future we can put one by one, a little bit, something like that. So this is the main. Not the main, but I mean this is like okay, we will work very hard to improve the nursing activity in the hospital to help the patient and the family, because not easy to gain the medical doctors, you know that, right? And then for the second questions, yes, in the current situation for the COVID-19, so the hospital issued the policy that nobody can come to the hospital, right? To restrict the transmission of the virus. So this is happens in every hospital in Indonesia, but they can give permission for one family to accompany patients. Just only one, cannot change to another family, only one. So if the patient stay in the hospital for 1 week, 2 weeks, so only one family, the family cannot going home, cannot go anywhere, only one. Because if they going out from the room of the patient, it means that they can transfer, they can infect many people in outside, something like that. So this also when we conducted the research about the psychological problem of the patients and family, especially the family who accompany patient for a long time in the hospital, they express their feelings, their anxiety, their physical problem, because they felt tired to stay every day, whole day, accompany patient in the hospitals. And we also report this to the hospital. And how can we do as a nurse to help the family? Because they also need emotional support, psychological support during the accompany and help the patients. But for the intensive care unit, it's also depend on the hospital. Some hospital, they give permission to come to the family, come inside and help the patient. But most hospital, no, for intensive care unit, only for the nurses and health worker can deliver the health care or taking care of the patient for the intensive care unit. So it's depend on the hospital policy as well. That's my answer, Professor. Thank you.
Professor Catherine Wang, you can hear me? Okay, that's the discussion or the question answer between Professor Catherine Wang and Mr. Agianto about the how to care the patient, take care of the patient from the use message, interpretation, and giving medical education to the family, and also the explanation about how to care the patient in the hospital by family and also, and of course the nurses. Okay, from the last question, do we have a question from the student of Nursing Academy KESDAM 6 Tanjung Pura, and also from the National TV University of Nursing, Health and Science? Boleh langsung ke Pak Gianto kan? Oke, untuk mahasiswanya juga bisa bertanya dengan bahasa Indonesia karena pemateri kita juga bahasa dari Indonesia.
Monggo silakan Mbak Mas semuanya yang mau bertanya dalam bahasa Indonesia.
Mungkin semuanya sudah paham karena presentasi ataupun penyampaian materi dari Mr. Agianto sangat impresif.
Excuse me.
Okay, do you have a question?
Language. My name is Philippus. I'm from Akper KESDAM 6 Tanjung Pura, and I'm soldier too. Is the discuss interested because any part talk about, excuse me. Okay.
Oke, mungkin di sana banyak yang Zoom, jadi suaranya tuh mungkin bisa di mute ya, biar nggak mantul.
Any part is talk about oxygen therapy. In pandemic is important. How we as now use the oxygen. Maybe Mr. Agianto can give us how to more specific use the simple max, NRM or nasal canul. Maybe any different in Indonesia or Taiwan. Thank you.
Okay, thank you very much. Can I answer? I can answer in Bahasa or in English. Which one do you like?
Okay, some of the lecturer here give a suggestion just in Indonesia. Doctor, you still with us?
Maybe can use English because in Taipei don't understand in Bahasa. Thank you.
Okay, that's good. Okay, we have something trouble with Mr. Agianto. Mr. Agianto, you still with us?
So sorry, I
mute.
Yes, hello.
Yes.
Okay, I'm very sorry because I lost the internet connection because the electricity is off. All right. I didn't hear your answer. Can I answer it in Bahasa or in English?
Okay, the questioner asked just for in English because the Indonesia TPF student can understand if you answer in Bahasa.
Oke, jadi saya jawab bahasa Indonesia ya. Or in English, my answer.
Okay, maybe audience in Taiwan maybe not understand in Bahasa. Thank you.
Okay, now. Okay. So okay, I will answer. Thank you very much for your questions. So if we as a nurse want to give the oxygen therapy, which one is appropriate for our patients? Be nasal, simple mask, non-rebreathing mask, or another kind of oxygen therapy that. So we have to calculate the oxygen fraction first. Fraksi oksigen in bahasa Indonesia. So we have to know the oxygen fraction first. How to get the number of oxygen fractions? We have to get the number of the result of artery blood gas or blood gas artery BGA, the content of oxygens, pressures, the CO2 base axis, and then HCO3, something like that, and then we can put the number of the artery blood gas to the formulate of the oxygen fractions. How many fraction that we got from the formulate? If the result is 80%, something like that, means that don't use binasals to your patients because your patient need concentrated oxygen concentrations 80%. And we can see the situation of the patients. Which one is the patient needs, rebreathing or non-rebreathing? So if you want to use this, you have to calculate first the result of arterial blood gas to the fraction oxygen fraction formulate, and then you can got the fraction result. And after that, the result is can appropriate for which one of oxygen therapy. It's easy. You can get this to the intensive care guidelines. They can provide these formulations, and also for the respirations disease guidelines. So it can help you to guide you. So the formulation is the most important. The fraction oxygen formulation is very important before we choose which oxygen therapy that we can use for the patients. So this is the same thing. The stroke patient who admit and take care in the intensive care unit, or the patient with another disease who take care in the intensive care unit, they can get the oxygen therapy based on the fraction oxygen formulate. So it's the same. Thank you.
Okay, brother. Yeah. Okay, brother Pripus, did you get the answer?
Yes, I got it. Thank you for the Mr. Agianto for the answer.
Anytime, my pleasure.
Okay, we have running out the time. Thank you for the Mr. Agianto for the great presentation about the stroke cases in Indonesia. Now we are going to the end of the last speaker today. Let me welcome to you our last speaker today from Mrs. Baida Escape NS MCAP. She is as the first Deputy Director of Nursing Academy KESDAM. Mrs. Time is yours.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Mungkin saya menyapa Pak Arik. Pak Arik masih di ruang Zoom?
Masih, Bu Baida.
Terima kasih ya Pak, sudah banyak membantu institusi kami.
Ya,
Saya
sama-sama,
boleh,
Bu Baida.
ini ada Prof. Yawinsi ya, Mrs. Catherine. Hello.
Hello. Thank you very much. I'm still online.
Hello, Mom Catherine.
Hi.
Pak boleh nanya ya, how methods learning di pandemic Taiwan?
Yes, we are well, and we hope you are well.
Okay, promise. Seminar. Hello everyone, good morning. Thank you for coming and welcome to this Taiwan speaker at Nursing Academy KESDAM 6 Tanjung Pura. Today I would like to listen to you about increasing the role of parent in stunting cases. Next. Yeah. I will tell you stunting cases in Indonesia. Okay. As you can see on the slide, two children has same act about defend and bodita. 7 million children in Indonesia stunted in 2020. Next. Okay. Based on the data, Indonesian and fighting of stunting case ascended and 2019 for the other countries, but stunting cases from 2022, 2021 Indonesia a decline and and you can see the slide decline to significant. This decline also had contribution by government, health sector, and family preventive. What is stunting? According to WHO, stunting is a disorder growth in developed and children signs of body same act difference with body tone. Many people don't know about this condition. Anything is normal. Operator sebelumnya, yeah. The slide. Many people don't know about this condition and think it's normal, even though it's a nutritional deficiency. Okay, next. Yeah. Physiology stunting, lack of nutrition, give infected, and adequate stimulasi nursing. Other cases, lack knowledge of mother about nutritional health before and during pregnancy. Less of good nutrition or food, health facility are limited, less of fresh water and sanitation. Because the principal and like government special health sector had to access and give fastest to them. Next. According to UNICEF, stunting is defined as the percentage of children aged 0 to 59 months in minutes high to they call stunted. Next. The stunting divided into which are chronic and acute. The acute powerful indicator long-term mortality and productivity, and acute powerful indicator short-term mortality. Okay, and the next here. Okay, stunting has in fact repel intelligence, disease, susceptibility, lowering productivity, and then their economy, growth, increasing poverty and inequality. The children has stunted has influenced their brain to think and maybe they have to express this idea. In the other words, to achievement were decreased and not good for the who vocal is golden egg. So with the result, the economics is part this condition not only influencer deals with bad LCD family member. Then concrete problem and short-term consequence dan long-term consequence. The consent problem has improvement dan developmental dan ekonomik. Kalau di short term head itu peningkatan mortality dan peningkatan productivity. Kalau long term consequence itu ada penurunan stunting adolescent, terjadi obesitas. Kemudian ada developmental itu penurunan kognitif, terjadi penurunan school performance, and economic work capacity and work productivity. Stunting growth and development, and ini case-nya household and family factor. One, maternal factor, two, of environment. Jadi pengaruh dari sejak dari janin juga bisa terjadinya stunting, kemudian dari lingkungan rumah itu sendiri yang bisa terjadinya anak menyebabkan terjadinya stunting. Kemudian dari inadequate complementary feeding, yang pertama adalah for quality food. Jadi maksudnya di sini adalah kualitas makanan, kemudian inadequate praktek, jadi tidak begitu memperhatikan tentang ketaatan anak diberikan nutrisi yang bagus. Kemudian adalah kebersihan dan sanitasi. Jadi untuk menghindari terjadinya stunting ini sebenarnya tidak hanya dari adanya program pemerintah, namun juga dari ibunya sendiri bisa memperhatikan kondisi nutrisinya itu mulai dari dia hamil sampai anak balita.
Okay, stunting get to the children not only from their age 0 to 15-19, but also it can influence from the still in the pregnancy. This because about the lack of knowledge, lack of nutrition, of food, or something like that about the healthcare.
Okay, lanjut next. Distill nutrition status, category underweight, normal, overweight, obese, obese 1, obese 2, obese 3. Next. Okay. Research relative of stunting. Several studies relative of stunting cases mengenai the stunting is influenced by the level of education, knowledge, and social economy. Another study suspects that stunting cases can be overcome depending on the role of the person parenting provided. The factor has influence of stunting handling, the role of parent in motivation the children, but both internal and external. How to provide in
Next.
internal motivation to children. According to KTW 2017, the research to hazard juvenile parenting is very effective and creates the portion and value of childhood. Hypnoparenting is given continuously for 20 days and short not interruptive. What is hypnoparenting? Hypnoparenting is giving positive word and or positive motivation to children will they go to bed. Hypnoparenting give internal motivation to the children daring at brainstorm kita. Another factor of stunting. Next. Okay. The parent role is very important. Is preventing stunting, not only provide internal motivation, but external motivation in support from all the providers. Modifikasi food menu is important. Kemudian di successful the clinic of children, stunting is parent role give them some knowledge to take care, also has proactive and provider education by government beside with help education and study education give to their parents. Next, okay, I'm share something yang saya ketahui, mudah-mudahan ini bisa memberikan manfaat. That's our topic present to you. Thank you for great attention and good contribution to this seminar. Thank you and have a nice day. Terima kasih.
About the increased parents' knowledge about the stunting scare to the children. So, like as usual, from the audience and participant or the student, have you any question, please ask.
Hello. Hello, I'm Jessie from Taiwan.
Okay.
Can you hear me?
Yes, I can hear you.
Thank you for the presentation. I've heard a lot of family supporting system for treating the stunting cases, but I'm just wondering that other than family supporting for stunting children, especially, what is the specific medical treatment for them?
Okay, and then?
Yeah, can you please answer? Thank you.
Apakah ada support lain dari keluarga?
Support keluarga mengatasi anak yang dengan stunting. Jadi support itu bentuknya tidak hanya anak kita suruh mau makan, tetapi kita memberikan motivasi itu adalah secara internal. Jadi dengan teknik hypnoparenting. Jadi hypnoparenting itu nanti dia akan anaknya itu disuruh makan itu dengan sendirinya tanpa kita suruh. Ya itu jadi kita memberikan motivasi internal. Tentunya motivasi ini tidak hanya dari diri anak sendiri, tetapi orang tua juga memberikan variasi dalam memberikan variasi makanan kemudian dukungan dari anggota keluarga yang lainnya, dan lingkungan di sekitarnya. Dan juga selain itu kebersihan lingkungan. Nah, di sekolahnya juga itu adalah menjadi dukungan juga. Jadi tidak hanya support child di home, tapi juga di lingkungan sekitar, di tempatnya di sekolah juga, itu juga sangat mempengaruhi.
Okay, I give a translate. The family support not only give them good nutrition or good food, but also give hypnoparenting, giving positive motivation for them. So that motivation or the suggestion for them, they can eat for itself, not only but just give the suggestion. This support also take care from the school, sociality, not only for home, but also the outside, such as the sociality, educational of the school, and also their friends. Thank you.
Okay, I see. Thank you.
Okay, welcome. That's all. That is the first question from Ms. Veda from the student of National TP Health and Science. Do we have a question from audience, students, participants?
Yes, I have questions about the stunning cases. Okay, my question is stunning. There's 30% to 40% that will get the stunning disease, and the cause of the stunning disease is lack of the nutrition, right? But I see your PowerPoint. I find questions. I'm curious about why you separate the stunning children divided under 5 and beyond 5 of the ages, because I would like to know the difference between how families to care the stunning child but for the different part, just for beyond the 5 age and under 5 age. What's the difference of caring in their families?
Okay, thank you. The first of all, I would like to know your name.
He is from in our university, the National Taipei University of Nursing and Health Science. She's the second speaker for tomorrow, the second student from tomorrow's presentation from our university.
Okay, thank you for the good question. Jadi dia nanya bagaimana apa itu menjadi anak yang beda usia.
Question.
Yeah.
Oke. Bagaimana peran keluarga dalam menangani anak yang mengalami stunting ya pada saat balita?
Balita atau dewasa?
Balita.
Apakah ada beda?
Balita dan dewasa ya, apakah ada perbedaan? Di sini tentu ada perbedaan. Peran orang tua menghadapi anak stunting pada anak saat usia balita, itu tentunya saat usia balita, orang tua itu lebih banyak memerankan perannya, memberikan makanan kepada dan mengenalkan makanan-makanan itu kepada anak sehingga dia tertarik. Nah, beda dengan anak yang sudah besar, terjadinya stunting itu banyak penyebab terjadinya pada saat sudah besar anak stunting itu. Pertama adalah karena penyakit infeksi. Nah, penyakit infeksi ini adalah kebanyakannya didapat dari kurangnya mendapatkan akses makanan dari keluarga tersebut. Nah, sebenarnya di Indonesia kebanyakan yang terjadinya stunting itu ada di daerah pedesaan. Sebenarnya mereka bisa mengelola apa yang mereka di desa tersebut seperti menanam sayur dan buah-buahan. Itu anak yang stunting pada saat sudah besar itu mungkin lebih kita berikan makanan yang sehat. Kemudian anak yang dengan stunting kalau sudah besar bisa terjadinya obesitas karena itu terjadi nanti hubungannya dengan adanya perubahan dalam metabolisme.
Okay, how to take care children different age between a child and the teen. The take care if they are have stunted, of course they are different. When the children on his child, I mean the take care for them is used from their food, of course the good nutrition for them, and of course different when they are 18. When they are 18, of course the support the family role of the family, of course depend. They will give a contribution for them. They also play their role as teen, such as giving them motivation, giving them knowledge, and giving them good nutrition. If they are teen has stunting, of course they are the future. Of course their weight will be obesity. Okay, did you get answer?
Hi, thank you for this is Catherine. Thank you for the Deputy Director's Bada for her wonderful presentation. Can you hear me?
Yes.
Great. Can I adding some information about the questions from our university? I think he mentioned about the cut point of age below 5 and age over 5. We in the children's health, there is evidence that age 6, like age 5 or 6, is the golden age, and we want the children when they're turning 6 to be healthy, to be within the normal range in their growth and development. However, nowadays we want our children to be within the normal range in terms of height and weight when they are before they're actually turning 3. So I really admire Deputy Director Bada talk about having nice words from the parents before the bed for their children. I think that's a wonderful ideas and wonderful research, because we want our parents to say something nice for their children when they're young, to be very positive, to be motivated, encouraging their children before they go to bed, because we also know that go to bed early will also help with their growth in terms of weight, height, and be healthy. Now, also, I would like to ask about infection in Indonesian children, because Deputy Director Bara talked about infection is one of the risk factor in Indonesian children. I agree, having enough nutrition, having clean water, and safety, they are all very important elements for children's growth and development. Can you talk a little bit more about infection? Because what kind of infection are you talking about? Are you talking about respiratory infection, or like like COVID-19 nowadays? Or are you talking about abdominal, gastrointestinal infection, which is actually more common in Indonesia?
Mungkin bisa saya bantu untuk translate ya, Bu Baida.
Yeah. Okay,
Professor Catherine Wang, I will help you to translate to
Indonesia
to make Deputy Director Baida to understand about your questions. Actually, jadi tadi beliau tuh tanya, Bu Baida kan tadi menjelaskan treatment untuk kasus stunting di bawah usia 5 tahun dan di atas 5 tahun itu kan beda. Nah, tadi bedanya apa? Yang pertama itu. Yang kedua, yang di atas 5 tahun itu kan lebih ke faktor resikonya terkait dengan infeksi. Nah, mungkin tadi belum dijelaskan infeksinya apa. Apakah terkait dengan infeksi pernafasan kayak seperti sekarang COVID-19 gitu ya, atau lebih ke infeksi yang mengarah ke abdominal disease atau gangguan pencernaan seperti itu. Karena beliau itu tertarik dengan risetnya Bu Baida tadi masalah itu, gitu. Jadi lebih ke infeksinya infeksi apa?
Terima kasih Pak Arif. Mungkin saya langsung menjawab. Kasus stunting yang dialami kalau sudah anaknya lebih dari 6 tahun itu dari hasil teori yang saya baca, memang kebanyakannya itu dari penyakit infeksi. Nah, penyakit infeksi itu kebanyakan dari mereka ada yang mengalami penyakit pneumonia yang akut, serta ada yang mengalami, anak itu sudah mengalami sebelumnya terjadinya marasmus dan kwashiorkor. Nah, itulah yang menyebabkan anak itu nanti menjadi stunting, dan juga kurangnya perawatan, Pak. Jadi perawatan itu anak itu dari orang tuanya itu terputus. Jadi dari rumah sakit sudah diobati sampai ke rumah itu dilanjutkan lagi perawatannya ke puskesmas, sehingga anak ini sebenarnya masih mengalami kekurangan nutrisi. Nah, itu yang menyebabkan anak pada lebih dari 6 tahun itu remaja dia mengalami stunting. Nah, tapi masyarakat di sini banyak menganggap itu hal yang biasa, karena nanti katanya kalau sudah dewasa mereka sudah bisa besar badannya. Nah, tingkat pemahaman orang tua yang sebenarnya belum memahami secara maksimal mengenai kekurangan stunting. Nah, kan di Indonesia menganggap itu hal yang biasa karena pengaruh budaya. Jadi mungkin Pak Arif bisa mengetahui di Indonesia itu ada beberapa makanan yang tidak disarankan oleh orang tuanya padanya untuk dimakan. Misalnya kayak hati ayam. Nah, itu anak itu jangan makan hati ayam gitu. Ya, seperti itu Pak. Jadi beda dengan anak yang mengalami stunting itu di bawah 5 tahun itu sebenarnya adalah breastfeeding, pemberian ASI. Jadi kalau orang tuanya kita support, gizinya kita support dari pemerintah, itu lebih mudah, Pak. Tapi kalau sudah besar itu penata laksananya itu lebih agak susah. Makanya dengan hipnoparenting itu teknik kehidupan itu kita memberikan motivasi internal ke gelombang otaknya sehingga dia termotivasi sendirinya untuk meningkatkan porsi makanan itu. Itu Pak Arif, terima kasih.
Terima kasih.
Duh, panjang juga ya.
Terima kasih. Terima kasih. For Eric, for being a translator.
All right, I just would like to make sure again for the answer because it's too long to translate. Jadi tadi untuk apa namanya faktor resikonya yang pertama karena pneumonia paling banyak kasusnya ya.
Iya.
Terus yang kedua kalau nggak salah tadi kurangnya nutrisi yang mengakibatkan ke kwashiorkor atau marasmus.
Ya.
Benar? Benar Mbak? Enggak Bu?
Ya benar.
Iya.
Benar ya. Terus yang ketiga itu karena tadi apa namanya apa yang tadi apa Bu yang kurangnya pengetahuan atau
ya kurangnya pemahaman orang tua Pak mengenai nutrisi pada anak pada saat anak itu dewasa remaja gitu Pak.
Jadi kalau misalnya ada masalah seperti itu tidak ditangani karena nanti kalau besar bisa ini sendiri gitu ya.
Karena pengaruh budaya.
Oke. Culture.
Okay. Eric. Let's make a summary. Yeah.
All right. I'm trying my best to explain about that.
Okay.
So you are questioning about a risk factor, right, for the children above of 5 years old, right?
Yeah, something like risk factors that Deputy Director Badar talk about the infection in Indonesia, and I would like to know what does it actually mean in Indonesian children.
Yeah, actually, most of the infections cases were pneumonia and also less of the nutrition intake that lead to the how to say that nutritional disturbances like kwashiorkor or marasmus. You know that, right? So actually the most cases of related to infection are those kind of infections.
Okay, right. So it's actually much more environmental induced infection in Indonesia's children. Unlike in Taiwan, we at the moment, because we all fully masked, our common infection for children in Taiwan currently is actually abdominal infection, gastrointestinal infection. Before the COVID-19, we have a lot of respiratory disorder like pneumonia, but because of the fully masked at the moment, so our children are pretty safe from respiratory disorders. I think I probably have some understanding now. You talk about malnutrition, you talk about environmentally induced infection. So that is very important risk factors to know, to help the parents to prevent this kind of problems that can be common in children in Indonesia. The reason I want to clarify with this is that you want to give parents information, but what did you actually give them? Because that is the most important information for the parents to look for environmentally induced factors. And in addition with nutritional, which I think is very important, make sure they have a balanced nutritional diet, make sure they actually sleep early, having a lot of love and encouragement from the parents, so that their problem of stunting might reduced in the long run. Because at the moment, we don't have a clear linkage of information at the moment, evidence to say that the relationship between stunt in children and other factors. I must say that we need to have more clear information. Usually it's about related to genetic factors that related to children in stunt, at the moment in the current literature. But thank you very much. Terima kasih for Deputy Director Pada for her wonderful presentation. Thank you.
All right. Tadi udah selesai ibunya. Aduh, apa namanya, Profesor?
Okay, that's the discussion about the additional knowledge from the Professor Catherine Wang about the stunting cases, both in Indonesia or abroad, such as like Taiwan, but from the infection, the fracture, the treatment, and also the how to take care if the children stunted. Okay, thank you. Mrs. Veda for the great presentation about the increased parents' knowledge about the stunting.
Thank you too.
The presenter has ended, and we will meet again tomorrow about discuss about case study between nursing student from the Nursing Academy KESDAM 6 Tanjung Pura and student of National Taipei University of Nursing, Health and Science in same time and same place. Thank you and have a good night day. Thank you.
Thank you very much. Thank you very much. See you tomorrow.
See you.
Thank you for the host and the translation.
Okay, anytime.
Thank you very much, everyone. Professor, thank you. Mr. Arik,
Bye.
thank you.
Thank you, Mr. Agianto. Thank you, Professor.
Pak Erik, besok kuliahnya masih sama Pak ya? Untuk kuliah besok masih menggunakan yang sama Pak?
Masih on? Okay, tomorrow we also use same links on Zoom and also same time at 8 AM.
Terima kasih.
Thank you.
Thank you.
Thank you.